Hello, in this video we're going to deal with the Nobel Prize in Physiology or Medicine for 1912, awarded to Alexis Carrel for his work on vascular suture and the transplantation of blood vessels and organs. Here you see him at work, together with Charles Lindbergh, the flying ace, making a respiratory pump together. Here you see it, the perfusion pump, they invented together. Then the Nobel Prize lecture itself, the suture of blood vessels and transplantation of organs. Summarized by me. Replacing diseased organ with new ones is an old wish, but what was lacking was a way to maintain normal circulation, uniting with the blood vessels. So I started to investigate in what way vascular anastomosis can be done, using Pear's and Murphy's method. Morel and Guthrie assisted. It took 3.5 years to achieve success. Some general rules. Stenosis, hemorrhages and thrombosis must be avoided. Rigid apophysis is needed. Damaging the vessels is to be avoided, and during the operation must be humidified by a rigorous solution. The wounds must be stitched with sharp needles to keep the wounds only as small as possible. Then the technique used in the vascular anastomosis procedure are serifying Carrel clamps, smooth-jawed, gentle forceps, round, straight, curvy needles, rubber-covered, isolated threads, Vaseline extra. Carrel describes in detail the stages of an operation. Details are skipped here. Just 3 steps are given. Temporary hemostasis and preparation of the vessels, then 2 suture and 3 establishment of the circulation. Then the results. Many vascular suture and anastomosis were performed by above method on animals and on man. Arteries and veins, large and small. It can even be done without the circulation being interrupted using a paraffin tube as a version. It is difficult when the vessel is deeply situated. No hemorrhages was ever observed, no stenosis produced, no thrombosis occurred. An obliteration was directed in 5% of the cases. Sometimes deposits of fibrin were detected. The stitches became invisible in the months after the operation. Often one could not see where the anastomosis had taken place. The union is so exact that the scar is very slight, often without any fibrous tissue. The elastic tunic around the vessels often showed vein scars. The method was successfully used on animals and on humans. Then on transplantation of blood vessels, there are uni- and B-terminal vascular transplantations. Unithermal grafting one extremity of a vessel to another part of the vascular system. Its goal is to increase the quality of the blood circulation and to modify its pressure. Vessels readily adapt to the changes in pressure. More pressure leads to a thickening of the walls, but also to hypertrophy of the muscular coat and sclerosis of the intima. These operations show how sensitive the walls of the vessels are to change in the pressure in the blood, but are able to adapt. By terminal transplantation, interposing a vessel segment between the ends of another vessel. The first arterial transplantation was in 1896 by Jaboulet, but thrombosis occurred. In 1905, Hüpfner improved the procedure. Guthrie and I followed with good results. Autoplastic transformation did not change the vessel. Homoplastic transplantations. Elastic fibers remained normal, muscle fibers disappeared, intima had thickened. In heteroplastic transplantations, different results. Obliteration of the vessel often occurs. If not, the caliber of the vessel became larger, but no aneurysms. The elastic and the muscular fibers of the wall disappearing, leaving increased connective tissue and thickening of the anima. Still, the vessels were able to function for years, this even when the vessels had to be kept in cold storage for no more than 2 to 3 months. The first transplantation of veins was in 1898 by Gluckin. They quickly obliterated. Attempts by Exner, Hübner, and Guiones also failed. Guthrie and I succeeded in 1905 on a dog who continued to live for 2 years. Autopsy showed no change in the vessel except for the disappearance of the muscular fibers. In general, vein walls become thicker. The lumen slightly dilated, but never aneurysm. The connective tissue increased. The fibers remain in autoplastic cases. The same in homoplastic cases, except muscular fibers disappearing. It was even possible to replace a section of the aorta by a vein or a tube of peritoneum, or even tubes of rubber of paraffin covered tubes of glass or metal. Even the inorganic The method did not cause a thrombus, making blood transfusion simpler. Transplantation of arteries and veins is safely possible if the proper procedures are followed. And transplantation of limbs from organs. Look at this from a surgical and a biological point of view. I sought to develop a technique enabling the blood circulation. I found an entire anatomic region can be transplanted, autoplastic or homoplastic. Carrel gives an example of an entire procedure which I have skipped here. It was the transplantation from one dog to another of the anatomic structure supplied by the external carotid artery. From a dog, the right part of the scalp and the auricle were extirpated in one mass with the auditory canal, the connective tissue and the glands of the radial-maxillary space and the upper portion of the external jugular vein and the common carotid artery, apart from abscesses that could be drained. The animal, however, died of PNA after 3 weeks, but the transplanted parts were found to be normal. The blood circulation was normal, but there was a reaction against the transplanted anatomic region. In 1907, I started transplantation of limbs. A.B. and Homer in 1891 and 1903 transplanted a limb and a hip of a dog. My first attempt with a dog thigh was in 1905. All animals died. My next attempt was in 1908 with a dog hind limb with more success, described in detail, which is skipped here. Important was that all the blood was ejected from the limb to avoid embolisms. Tension on the vessel must also be avoided to avoid congestion in the limb. Variations were the transplantation of a front limb or hip, but again after about 10 days the dog's conditions worsened and died. Again, not by a failed circulation, but by a reaction against a new organ. During a later attempt, the dog survived for 20 years, then died, but not by a problem of blood circulation. The autopsy showed diffuse bronchopneumonia, again a death caused by general infection. It is not clear whether this is all coincidence. The technique has improved during the last 7 years of replantation and transplantation. Working with Morag and Guthrie, viral glands of dogs were replanted. This was confirmed by Teich and Macas. Followed were with the typhoid gland, the suprarrenal gland, ovaries, the intestine, the heart, the spleen. Some animals live for years with no problems with the transplanted organs. Especially the spleen is anatomically well adapted for these experiments. There have been several transplantations, animals living for years. Many experiments were done with kidneys of auto and homoplastic. Oeman in 1902 did the first and I followed the same year. The Costello, Beck, Fresco also did. I and Guthrie in 1905 did the first homeoplastic kidney transplantation. The kidney had to be placed at the correct place, otherwise it would not function. Again, details of the procedures are given, but I have skipped them. If you want to read them, you can always go to the original text, of course. Sometimes animals with transplanted kidneys developed stenosis in the ureter and died. This led to a change in the technique of the erythritol anastomosis, which did the job. The animals lived on. In other experiments, I studied the influence exercised by a transplanted kidney on its host. Several animals received a kidney from another animal. They all lived, but the transplanted kidney atrophied after a year. During the year of the level of albumine in the blood varied. Animals that got 2 new kidneys again seemed in good health for a while, then worsened and died within 15 to 25 days. Again, it seemed that the animals react against the presence of a new organ is the cause of death. We have to find out what exactly makes it possible for an organism to adapt to a new organ coming from another individual. Conclusion. The technique by which blood vessels are anatomosed is now used safely for humans. This will make it possible to perform all kinds of operations on humans, but it remains very difficult for very small vessels, but it has been used in blood transfusions for infants by Carrel and Suture. It has been demonstrated that the autoplastic transplantation of organs is always successful. It is not clear whether it will ever be possible to perform a successful homoplastic transplantation with permanent success. And with the red quote on this question, before this is accomplished, it will be necessary to discover a means of recognizing the individuals. If such exists, between whom organs can be interchanged with impunity. Thus, while the problem of the transplantation of organ has been solved from a surgical point of view, You see that this by no means suffices to render such operations of definite surgical practicability, and it will only be through a more fundamental study of the biological relationships existing between living tissues that the problem involved will come to be solved and thereby render possible the benefits to humanity which we hope to see accomplished in the future. Okay, again, this is a summary of the Nobel Prize lecture, not a complete Nobel Prize lecture. If you want to read the complete lecture, follow the link, which will also be in the description of the video. You can see, by the way, the hospital in which Alex Carrel worked in 1917, which was in France. Then you see the inferior of the same hospital. It was, of course, during the World War. And you see the plans of the pavilion, of two of the pavilions. Okay, this was it for the moment. Next week we will go on to the year 1913. Again, we will deal with the Nobel Prize in Physiology or Medicine, but also chemistry and physics. And the week after that, we will deal with the same prizes, but then not in a general way, but dealing with, just as this week, the Nobel Prize lectures. For now, thank you for watching, and maybe till another time.